Hi, my name is Julian. I'm going to be comparing the two most prominently used hypnotic medications for insomnia disorder, Z-hypnotics and benzodiazepines. While both sedative hypnotics have great similarities in reducing insomnia, they both have noticeably distinct effects that I'll be discussing later on in the video. So first, what is chronic insomnia disorder? Chronic insomnia is defined by the International Classification of Sleep Disorders as dissatisfaction with sleep quantity or quality when the patient has adequate time and circumstances to sleep. Pictured here is an abbreviated checklist for insomnia classification used by the International Classification of Sleep Disorders. Insomnia disorder is associated with difficulty initiating or maintaining sleep and early morning waking with the inability to return to sleep. Chronic insomnia disorder specifies that these symptoms must be present for at least 3 nights per week for a minimum of 3 months and must cause clinically significant functional distress or impairment during daily life. When one has been diagnosed with chronic insomnia disorder, the usual go-to treatments are non-pharmacological in nature, meaning they do not use any sort of medication. I'll briefly describe the most well-regarded of these treatments by the scientific community, CBTI. CBTI stands for Cognitive Behavioral Therapy for Insomnia. The American College of Physicians details that CBTI consists of cognitive therapy, behavioral interventions, and educational interventions. Pictured here is an example of a common practice used in CBTI called sleep hygiene, where one might be taught by a medical professional trained in CBTI to incorporate things like a nighttime routine or limiting caffeine intake before going to bed. However, CBTI has some drawbacks. Jeffrey Rossman of the American Journal of Lifestyle Medicine describes that while CBTI is safe and highly effective, it is largely underutilized primarily because of 2 reasons. 1, there's currently a shortage of trained CBTI practitioners, and 2, patients are much more likely to learn about sleep medication as a treatment for their insomnia. So this made me think. Since patients are more likely to learn about sleep medication as treatment for their insomnia, then which medications specifically would be best to use? The most common hypnotic agents used in pharmacological treatment are benzodiazepines, such as diazepam or lorazepam, and Z-hypnotics, or non-benzodiazepines, such as zolpidem and zaloplam. These medications work by increasing activity of the neurotransmitter GABA. GABA is known to be the main inhibitory neurotransmitter of the CNS, and it is well established that specifically activating the GABA-A receptors favors sleep. By using either Z-hypnotics or benzodiazepines, the drugs will bind to the GABA-A receptor and increase its GABA activity. So while both hypnotics act on GABA, the difference between them lies in which subunits are specifically bound to in GABA-A's receptor complex. This image comes from an experiment published by the University of Michigan's Department of Anesthesiology on GABA-A receptor drug specificity. As seen in the image, benzodiazepines, namely diazepam, were found to bind more readily to alpha subunits 1, 2, 3, and 5 on the GABA-A complex, whereas Z-hypnotics like zolpidem seem to bind mostly with alpha 1 subunits, significantly decreasing in binding affinity along all other subunits 2, 3, and 5. Why is this important? When compared to all other alpha subunits, the alpha 1 subunit is most directly associated to sleep. So as benzodiazepine occupies unwanted receptor subunits 2, 3, and 5, Z-hypnotics optimally select to the alpha 1 subunit, or what psychiatrist David Nutt terms the hypnotic subunit. Benzodiazepines' larger receptor occupation of alpha subunits 2, 3, and 5 lends to profound pharmacological action in their effect on sleep architecture. Sleep architecture is the alternating cycle of non-rapid eye movement and rapid eye movement sleep that occurs throughout a given night. In Montplaisir's study on Z-hypnotics and benzodiazepines, he compiled decades of evidence from the scientific community, definitively concluding that Z-hypnotics have shown equal or even superior sedating properties when compared to benzodiazepines. More notably, Montplaisir describes there are little to no adverse side effects of Z-hypnotics found on sleep architecture or daytime fatigue, by virtue of its binding selectivity, whereas benzodiazepines have induced major modification with the reduction of slow-wave sleep. As slow-wave sleep is directly correlated to the restorative function of sleep, the use of benzodiazepines has been shown to contribute to daytime fatigue and impairment. In terms of tolerance to the medications in question, meaning the body's need for higher doses to achieve similar effects, A far lesser risk of tolerance and abuse potential arises in studies on Z-hypnotics, again as a result of its unique and optimized interaction with the GABA A receptors. For instance, systematic trials from 2 studies carried out by Greenblatt and Rush both concluded that the common Z-hypnotic Zaloplan had no tolerability issues or any signs of abuse potential. Benzodiazepines, on the other hand, carry the greatest risk of tolerance and even abuse potential. The National Institute of Clinical Excellence estimates that 10 to 30% of chronic benzodiazepine use patients are physically dependent on the drug, with at least a third of these patients experiencing problems stopping or reducing their dose. As someone who was prescribed Zolpidem, a common Z-hypnotic, this summer to help alleviate my own insomnia, this project has allowed me to explore what medications could aid me the most in my journey. The use of Z-hypnotics seems to truly be the most advantageous after understanding its unique chemical interactions when compared to benzodiazepines. Thank you very much.